Good day, everyone. Visual diagnosis, inspection, eye color. Inspecting the color of the eye. In general, this refers to the colors found in the sclera. Eye color may also be extended into the iris and pupil. The normal color of the eye should be white in sclera, slightly red at the inner and outer canthi, brown or blue, green, gray, etc. in the iris, and black in the pupil. All colors should be clearly distinguishable. Clinical significance, changes in eye color often signify pathogenic factors and their pathogenesis. Pathomechanism, redness in the eyes indicates pathogenic heat invading the body. Heat injures the blood vessels and causes bleeding. It also pushes blood upward to fill the blood vessels, giving rise to a red color. White color indicates a lack of blood to fill the vessels. This can be due to Qi or blood deficiency or Yang deficiency with cold, which obstruct the blood vessels and leads to insufficient blood. Yellow eye color indicates that the liver and gallbladder channels are obstructed by dampness, Qi, or blood stasis. In each case, the stagnation generates heat, which steams bile in the liver and gallbladder, which rises up to the eyes. Black eye color is caused by extreme heat consuming the body fluids and concentrating the blood, which gives rise to the darker color. The color black is associated with kidney failure by virtue of its five-phase correspondence. Blue-green indicates wind or liver dysfunction. The blue-green color is associated with wind and the liver by virtue of its five-phase correspondence. This is the eye color. Okay. Pathogenic heat injures blood vessels or causes blood to rise upward. That is color red. Then liver and gallbladder channel obstructed by pathogens, heat ensues, bile streams upward to manifest in eyes. That is yellow. Then insufficient blood fails to fill up the channels and nourish the eyes, or turbid phlegm deposit on the eye. That is the color white. Heat causes bleeding or severely injures body fluids and concentrates the blood, or kidney failure. That is color black. Liver function disorder creates wind or pathogenic cold obstructs the blood vessel. That is blue-green. That is the pathogenism of the eye. Pathological changes of eye color and their indication. Letter A, yellow. Yellow on sclera that may extend to the iris and pupil. Yellow signifies dampness. And yellow color, pale yellow gradually becoming bright yellow orange. The symptoms is yellow urine, yellow tongue coating, and the indication of this is damp heat. And yellow color, pale yellow, sometimes affects the vision. The other symptoms is fatigue, loose stools, and the indication is blood deficiency. And dull yellow color, that is chronic. The symptoms is abdominal bloating, cold glimpse, and the indication is cold damp. In golden yellow color of the eye and body, acute onset. And the other symptoms is fever, irritability, and constipation. And the indication is toxic heat. In dim dull yellow, other symptoms is difficult urination, abdominal distension, and the indication is Qi and blood stagnation. Letter B, in color red, extensive redness on the inner or outer canthus or on the sclera, red vessels may also appear over the entire eye. Red signifies heat, red color. Red in the canthus area. Their symptoms is excessive tearing, irritability, red tongue, and dark urine. And the indication is heat in the heart. Redness and swelling in the entire eye. The other symptoms is headache, easily angered, and the indication is rising of liver fire or exterior wing heat. Red and the sclera of the eyes. The other symptoms is sore throat, cough, and the indication is heat in the lung. Red in the iris and pupil of the eye pain. The other symptoms is eye pain, headache, dark urine, and the indication is excess heat in the bladder. Red that may extend into pupils. Other symptoms is dizziness, tinnitus, scanty tongue coating, and the indication is yin deficiency with heat. The blue-green or purple-red vessels on the sclera. The other symptoms is pain from physical trauma, and the indication is traumatic injury. The last one is the red eyes upon awakening that clear up later. The other symptoms, the bleeding and thirst. The indication is blood level heat. Letter C, blue-green. Blue-green on the sclera or iris. Blue-green signifies wind and cold. The blue-green color in sclera. Other symptoms is severe headache, nausea, irritability, restlessness, and with the indication of wind fire attacking the eyes. Also in the blue-green color in the sclera, vertex headache, aversion to cold, desires warmth, and the indication is cold stagnation and pain. And blue-green on pupil, dry and dim sclera. Other symptoms is dizziness, tinnitus, insomnia, poor memory, and the indication is kidney yin deficiency. Letter D, black. Black on sclera, black signifies water. Black on sclera, which resembles crab eyes. And the other symptoms is severe pain, bitter taste in the mouth, and the indication is accumulation of excess heat. Black eye sockets. The other symptoms is dizziness, poor memory, tinnitus, irritability, scanty coating, and the indication is liver and kidney deficiency. And the black on the sclera, dim and dull eyeball. Other symptoms is feeble respiration, profuse sweating of oily sweat. And the indication is zang-organ qi depletion. Letter E, white. White on the inner or outer canthus is pale. The iris or pupil may also be white. White signifies deficiency. White ring around iris. The other symptoms is obesity, dizziness, stifling sensation in chest. And the indication is turbid phlegm. In iris color gradually lightening, the other symptoms is dim vision, cold limbs, loose stools, and frequent urination. And the indication is yang deficiency with cold. Cloudy white iris. Other symptoms, dizziness, tinnitus, irritability, red tongue, body, thirst. And the indication is liver and kidney deficiency. Pale white blood vessel in the canthus of the eyes. Other symptoms is fatigue, dizziness, dry skin, pale tongue in face, and the indication is qi and blood deficiency. Visual diagnosis of area around the eye. The area around the eyes includes both the eyelids and the area are just below the eyes. Visible changes in the color of the skin and in the moistness of this area may be observed. Attention should also be paid to the presence of the edema or puffiness in the area around the eyes. Color. The color most often observed in this area are black, green, blue-green, yellow, red, and white. Changes in skin color will most often be fairly subtle, often only a slight tint. Blackness of the skin around the eyes usually indicates a kidney imbalance. The color in this case must be seen in relation to the moistness of the skin and the area. If the skin is black and moist, then this can be a sign of kidney yang shu. There may well also be a fopness as a result of slight edema in the area. This will be due to inability of the kidneys to transport body fluids away from the area. If the skin is dry, there may be kidney yin shu. A black color can be easily confused with the blue-green Jing color. Therefore, you should, as always, compare this characteristic with the other signs and symptoms. A dark, dusky color around the eyes can also arise when phlegm or dampness block the movement of qi and shui in the fine network of vessels in this area. Blue-green and green around the eyes is usually a sign of liver qi stagnation. The difference between these two colors is an indicator of degree of liver qi stagnation that is. Liver qi stagnation can result in shui not circulating in the fine network of vessels as it should. Because the skin around the eyes is very thin and almost transparent, it will be easier to see the stagnation of shui here than in other areas of body. The stronger the qi stagnation, the more shui will stagnate. The blue-green color indicates a stronger stagnation of qi than green color does. A purple color indicates shui stagnation. Redness around the eyes is a sign of heat, generally shui heat. The redness can also be a sign of damp heat. In this case, the skin will often whip or flake as in seen in fungal infection of the skin. Whiteness can be shiny, pale, or pallid. A shiny whiteness around the eyes can be seen in an invasion of wind cold. Pale or pallid skin around the eyes is a sign of shui shu. The sallow complexion here can almost be yellowish. As is the case with the lips and the face in general, the use of makeup can negate the diagnostic observation of this area. The colors around the eyes, in observation, black and dry, the significance is kidney yin shui. Black and moist, the significance is kidney yang shui. Dark brown, dusky, the significance is phlegm or dampness. And the observation of blue-green or green, this is the significance is liver qi stagnation. In redness, the significance is heat. And white and shining, the significance is cold. And white, dry and sallow, shui shu. And purple, shui stagnation. Puffiness, including bags under the eyes. The area around the eyes may be swollen and puffy due to the presence of accumulated fluid. In chronic cases, it may result in bugs under the eyes. If the condition is acute, this will usually due to an invasion of wind cold or wind heat. This she can disturb the lung ability to spread and distribute the thin fluid. So this then accumulate in the lung. At the same time, qi will block the lung in its function of sending qi downwards. Lung qi can then become rebellious and rise upwards. The rebellious qi will carry the accumulated fluids upwards with it, resulting in puffiness in the face, especially in the area around the eye where the flesh is very thin. If the puffiness is chronic condition, it will probably be a manifestation of spleen or kidney yang. Spleen and kidney yang are responsible for transporting and transforming fluids. If there is yang in either or these organs, there will be an accumulation of fluid. The result will then be bugs below the eyes. As it is a shear condition, the bugs will be more noticeable and pronounced when the person is tired or has overstrained themselves. Thank you for your attention and have a good day to everyone.